Good day, everyone. Welcome to the Ready, Set, Go, a webinar series sponsored by HUD's Office of Special Needs Assistance Programs, known as SNAPS. My name is Jeff Ugay, and I work at Homebase, and I'll be moderating today's webinar. On behalf of SNAPS, I would like to thank all of you for joining us today. Today's webinar is Understanding the Emergency Solutions Grant Program CAPER. We'll be featuring the following presenters: Marlisa Grogan from HUD SNAPS office and Natalie Matthews from App Associates, who is a member of HUD's Technical Assistance team. Additionally, we have Susan Ziff and Michelle Budzek on the line with us as resource advisors to answer any questions that you may have. Before we begin today's presentation, I'd like to make some logistical announcements. Today's webinar will last approximately 60 minutes and is being recorded. The webinar recording and PowerPoint presentation will be posted next week on OneCPD Resource Exchange Training and Events page, the web address shown on your screen. The Find By box can be used to filter the hundreds of training materials available. At the conclusion of today's presentation, a brief feedback survey on this webinar will open in a new browser window. Participants are strongly encouraged to respond to the evaluation and to inform delivery of future webinars. Because of the large size of the audience, all attendees will remain on mute for the duration of this broadcast. You may submit questions to the COC Program Resource Advisors using the Q&A pod that will appear shortly on the left side of your screen. We recommend using your phone rather than your computer speakers to hear the audio for today's presentation. Due to the large number of attendees, there may be a slight delay in the advancement of slides. If you experience any other technical difficulties, please request assistance by using the Q&A pod that will show on the left-hand side of your screen. All of your questions are important to us. However, we will not have time to answer all of them. If we do not get to your question, please submit it to the OneCPD Ask a Question at the web address on your screen. Please remember to reference this presentation, Understanding the ESG CAPER, in your question. As a reminder, you will remain muted throughout the call, but you can submit any questions that you have via the Q&A pod appearing momentarily on your left side of the screen. The purpose of today's webinar is to provide guidance to the HMIS system administrators on how to generate an HMIS report for the ESG program CAPER. Upon completion of this webinar, participants will understand the data collection and reporting requirements for the revised ESG CAPER, be able to accurately interpret the revised ESG CAPER, and be able to identify the resources and assistance available to help with their ESG CAPER. Now I'd like to turn it over to Marlisa to begin the presentation.
Hi everyone, this is Marlisa. I'd actually like to start my portion of the webinar with a disclaimer. The intended audience is HMIS leads. A separate webinar is planned for ESG recipients and subrecipients on how to complete the CAPER. HUD's plan is to get the CAPER notice out before that webinar. The information we are providing in this webinar should not be confused with guidance on the program regulations or case file documentation. In fact, some items may seem confusing when trying to view it from that perspective. This is guidance for HMIS programming. Our first section of the webinar is an overview of the ESG program and the CAPER reporting requirements. So the HEARTH Act renames the Emergency Shelter Grants Program the Emergency Solutions Grants Program. Included in the HEARTH Act is the requirement that data is entered in HMIS or a comparable database for victim or legal services providers for all persons served in activities assisted with ESG. The ESG interim rule requires that all ESG recipients and subrecipients participate in their local HMIS. HUD directly funds 4 types of recipients: states, urban counties, metropolitan cities, and U.S. territories. State recipients subgrant funds to 2 types of subrecipients: local governments and private nonprofit organizations. Metro cities, urban counties, and territories may spend funds directly and/or subgrant funds to nonprofit subrecipients. An urban county may also carry out activities through any of its member governments. ESG funds can be used for 5 distinct components plus admin activities. Those components are street outreach, emergency shelter, rapid rehousing, homelessness prevention, and HMIS. Some transitional housing projects may still be receiving ESG funding under the emergency shelter component, but only those transitional housing projects that received ESG continuously since fiscal year 2010 are allowed to receive Emergency Solutions Grants funds. Some projects could receive ESG funding for essential services only, for example, outpatient health services under the emergency shelter component, or housing search and placement services under the homelessness prevention and rapid rehousing components. ESG accomplishments are reported to HUD via the Consolidated Annual Performance and Evaluation Report, CAPER. ESG is one part of the jurisdiction's report. The CAPER also encompasses 3 other formula grant programs, that's CDBG, Home, HOPWA, and a general section. One complete CAPER report is submitted to HUD by the recipient. Currently, ESG is the only program for which recipients must complete CAPER screens in the Integrated Disbursement and Information System, which is easily said as IDIS. Soon, all jurisdictions will be required to submit their entire CAPER in IDIS. Once a jurisdiction has an approved action plan in IDIS, it is required to submit the CAPER electronically via IDIS. But until that time, HUD requires jurisdictions to submit the CAPER in hard copy form. These ESG recipients should enter data into IDIS, export the data to a Word document, and submit them to HUD as part of their complete CAPER report, which would also include CDBG, Home, HOPWA, and the general section. HUD has developed an ESG program CAPER aggregation tool to help ESG recipients consolidate the information received from multiple subrecipients into one report that they can use to complete the CAPER in IDIS. HUD will also release a CAPER generation tool that can be used for HMIS systems that are not programmed to create a report specifically for the CAPER. This can be used at the recipient level or the subrecipient level. The CAPER is due to HUD within 90 days after the end of the recipient's program year. HUD recognizes that many continuums across the country did not meet the statutory requirements for HMIS participation in the first year of the new ESG program. ESG subrecipients' HMIS participation is a requirement per the McKinney-Vento Act as amended by the Hearth Act and the ESG program interim rule. When monitoring ESG recipients, HUD may issue a finding if subrecipients are not using HMIS or a comparable database. HUD developed the current CAPER as a transition CAPER and as a way to obtain data electronically and in a consistent format from all recipients in place of the old accomplishment screens in IDIS. Since it is sort of a bridge between the accomplishment screens and a new, more comprehensive ESG CAPER, HUD made the report short and based primarily on universal data elements. HUD plans to release a more comprehensive ESG CAPER in the future that is more like the COC APR. So it's the ESG recipient that is ultimately responsible for submitting the CAPER to HUD. Because HUD considers this a transitional CAPER, HUD is not yet requiring that HMISs be programmed to generate a single report that consolidates all subrecipients' data and provides an unduplicated count of persons served throughout the entire jurisdiction. Instead, HMISs should provide subrecipients with the functionality to generate an ESG CAPER subrecipient report. The recipient is then responsible for aggregating a final report to submit to HUD. The aggregation tool enables recipients with subrecipients who use multiple HMISs to consolidate the data into one report. The CAPER generation tool can be used for HMIS systems, as we said before, that are not programmed to create a report specifically for the CAPER. And again, it can be used by recipients or subrecipients. So in order for the recipient to complete the CAPER, subrecipients must provide the recipient all necessary data from HMIS. The ESG CAPER subrecipient report is programmed into the HMIS system to generate an HMIS report for the CAPER. As mentioned before, subrecipients may use the generation tool as a way to report CAPER data to a recipient. HMIS system administrators should obtain the information illustrated in this table from ESG recipients, which includes a list of subrecipients funded with ESG, the components that were funded by ESG for each subrecipient, and the CAPER reporting period, which is the recipient's reporting period. The reporting period starts on the recipient's program year start date and ends on the recipient's program year end date. So a few things to remember. Remember that ESG funding may be granted to a city, county, or state. It's possible for one project, for example, a shelter, to receive grants from more than one jurisdiction. So obtaining the list of subrecipients and projects funded might include receiving these from 3 different sources. It's also possible for subrecipients to have multiple ESG grants from different years from the same recipient in one report. And an example of this, let's say recipient A has a reporting period from January 1st through December 31st. Recipient A awards subrecipient Z with fiscal year 2012 and fiscal year 2013 grant funds. So subrecipient Z received an ESG grant for 2 years in a row, both 2012 and 2013. From January through April, let's say subrecipient Z only spent 2012 funds because they did not receive their 2013 grant funds until June. Subrecipient Z's report will still span January through December, the recipient's reporting period, and will include data on projects funded with 2012 and 2013 ESG dollars. I know that's a mouthful, but hopefully that example helped a little bit. Natalie, I'm now going to turn the webinar over to you to cover the specifics on HMIS setup.
Okay, thanks so much, Marlisa. So now that we've gone over a bit of the basics in terms of defining who the CAPER applies to and what the distinct responsibilities are, this part of the presentation in particular is really focused on ensuring that HMIS leads or HMIS system administrators know exactly how to correctly set up ESG projects in their system. So it's important not only that people understand this in the sysadmin role, but that everyone involved in the process has a clear sense of how this data should be properly set up. So we're going to go by each sort of component or type of activity that people could be doing under ESG and talk about how it relates in terms of the project type in HMIS. So we see on the first screen that emergency shelter is listed here, and the HMIS project type that should be is emergency shelter. There are 3 distinct categories or types reported under the emergency shelter project type for the CAPER. So one of them is intake and exit, the other is hotel motel, and then mass shelter. I'm just going to say a little bit about each category, and again, it's really critical that these are correctly set up in the HMIS so that the CAPER can be correctly generated. So intake and exit, as we see, it's described a bit here on the screen, but it basically counts the number of persons sheltered for each day that are in the project from intake date to exit date. Shelters should move, where possible, to this type of setup to account not only for all persons that have been served by the program, but to also be able to account for data required for shelters in the future. So intake and exit is sort of one type of activity that could be listed here under this type in HMIS. Hotel motel is, as the name sort of describes, going to count the number of persons staying in a hotel or motel that's funded by ESG. And again, it's going to do so from the date of entry to the date of exit. The last type, mass shelter. Some shelters in particular, usually large facilities for single persons, allow people to come and go through the shelter system without requiring that a full intake necessarily be done each and every time that they're sheltered in the program. So many mass shelters may intake one person in the shelter system at entry, but may not exit them right away. This practice it leads to persons being counted according to bed nights or service transactions. So rather than relying on the entry and exit dates per se, this instead looks at how many service nights someone had. So in these cases, the ESG report should only capture persons who used a bed during the reporting period. HUD, this is an important note for everyone to consider, and that's that HUD does not require or expect that individual beds within an emergency shelter are categorized by funder, meaning many programs have beds that are funded by a variety of projects. Some may be ESG beds, some may be funded by other funding streams. So in HUD's eyes, there's no expectation that an HMIS can identify a quote-unquote ESG bed from any other bed. HUD understands that often ESG funding is used to support general operating costs. So again, it's not anticipated that people can distinguish an ESG bed from another. But it is important that people are accurately capturing this data in HMIS. So to account for all this, emergency shelters with funding from ESG have to provide an unduplicated account of all persons residing in all beds on the project that were in the CAPER. So that's the requirement, is that people are still going to have to report out on everyone served, but there's not an expectation that people will be able to distinguish between an ESG bed or a bed funded by another funding stream. Okay, so the next thing to consider in terms of project setup are those sort of essential services, which are a type of a project that could be funded by ESG. So in HMIS, this could show up as either an emergency shelter, a services-only project, or a day shelter. So any street outreach essential services project should be reported under the street outreach HMIS project type. So it's important to understand sort of what type of services only or essential services program you're dealing with. All essential services under the emergency shelter component are those that are targeted towards literally homeless persons that are staying in a shelter, and therefore they should be reported under the emergency shelter component type in HMIS. Day shelters are considered a type of emergency shelter under the ESG program, and persons served by day shelters should also be reported under the emergency shelter project type for the CAPER. Your HMIS may be set up in a way that ESG-funded essential services, meaning those funded under the emergency shelter component, were entered into HMIS under the services-only project type. Ensure that the HMIS is set up so that clients receiving those services are counted under the emergency shelter project type for the purposes of the CAPER. So it's important to make sure that people that are receiving essential services are counted under ES so that they can accurately show up on the CAPER. Another important note from HUD on this part is that HUD recognizes that ESG, again, in the similar sense to the shelter programs, it may have only funded a portion of one type of service. For one example that we've got here is a shelter caseworker is among 10 different workers in a shelter, and so there's really not an expectation that this type of services would be sort of distinctly reported out in the HMIS. And HMIS is not going to be required to account only for persons that received services from an ESG-funded worker. It's instead going to be important that the CAPER generates a count on all persons that were served by the projects that receive some ESG funds. So again, if you're thinking at it from the program perspective, there are many different ways that projects are funded. There are many different combinations of funding sources, and so it's not expected that HMIS is going to be the vehicle for suddenly being able to distinguish between who receives services from someone funded solely by ESG. It's instead anticipated that if you get ESG service funding, that you're going to be able to report out in the CAPER on anyone that received those, anyone that received services. All right, for transitional housing, there are a couple notes here on transitional housing that we just want to go over. So the interim rule for the ESG program enabled communities that were previously funded under transitional housing projects in the FY 2010 competition to continue to fund them as emergency shelter under the Emergency Solutions Grant. In communities where this has happened, the HMIS should be set up to record the project in the transitional housing project type. However, in the CAPER report, those persons residing in transitional housing projects where any part of that project was funded with ESG funding will be recorded under the emergency shelter component. So it's important for other reports generated by HMIS, like the project's annual performance report, if they receive any COC funding, or the community's annual homeless assessment report, or their housing inventory count. It's important that these projects continue to be typed as transitional housing. Okay. And as we've got here on the screen, intake and exit, this is a similar setup to what we mentioned under emergency solutions in the sense that it's a setup that allows people to count persons from intake to exit. So one person may have multiple intakes during the course of the year, and that's fine. This is just the means that's recommended for projects set up here for transitional housing. All right, we've got a few more types of projects to go through. And the next one that we see here on the screen is street outreach. So in HMIS, this should be set up as a street outreach project. And it's important for people to understand for this project that there's some nuances that are very specific just to street outreach type that you're not going to encounter in other types of projects. So one is the date of contact and the date of engagement. So it's important that you make sure as the HMIS lead that this data is being collected for street outreach programs. The CAPER, as we'll show you in just a few more slides when we go over the actual screens, HUD's going to ask people to give information on both dates of contacts and dates of engagement. So for ESG-funded street projects, it's important, street outreach projects, excuse me, it's very, very important to make sure that they're collecting that information here so that the CAPER can be generated. Street outreach reports are going to be generated on all persons within the program who have an open record within the reporting period. Persons that are counted are going to include those that have contacts that are dated within the reporting period or a date of engagement during the reporting period. So that's a really important piece of information to understand in that a client doesn't have to necessarily be engaged to show up here. And the CAPER, HUD's also going to ask for counts of people who had a contact. So this, in general, as Marlisa mentioned, using HMIS to collect data for ESG is often very new for a lot of these projects, so it's important that as you're working with street outreach programs that they understand the real value and the real need to collect date of contact and date of engagement for projects. All right, moving right along, rapid rehousing is another type of project that we're going to see in the CAPER in ESG. The HMIS project type that it should be set up as in your system is simply that, rapid rehousing. So for this project, it's encouraged that people set up an intake and exit system that allows, again, people to be tracked from intake to exit. As was described for other components or project types, it's going to be very possible that people may have multiple intakes during the year, and that's fine. The important thing to acknowledge about this, and it ties into a component that we haven't gone over yet, but will in the next slide, and that's prevention. So as you notice, rapid rehousing and prevention for the purposes of the ESG CAPER are separated. And what I mean by that is, unlike the homelessness prevention and rapid rehousing program, or HPRP, where those are treated as one sort of type of project in your HMIS, these are instead going to be treated separately. So it's very important that vendors and that projects set them up separately. So rapid rehousing and prevention are two very different types of activities, and they've got to be set up distinctly in your system. If either your rapid rehousing project or your prevention project were incorrectly set up, then the system administrator should take the initiative to make the corrections for the project types now. So the train's sort of just starting to move with CAPER reporting and data collection, and as was mentioned earlier in the presentation, this is really a transitional report. It's really something that HUD intends to probably expand on, and that may change over time. So now is the time to get all the ducks in a row to get everything set up properly. The CAPER is only going to be reporting on those persons who had an open record in the rapid rehousing project type at some point within the reporting period. So this could very easily include persons whose record were open and then closed within the reporting period. So again, different than street outreach, that's sort of its own distinct way of the contacts and the engagements. This for rapid rehousing is back to intake and exit and looking at people within that reporting period who had a record. If you don't know how to set this up, if you're an HMIS sysadmin and you're not quite sure how to set this up in your software, then it's most important that you reach out to your HMIS vendor. HUD has been working very closely with vendors to provide consistent guidance on this, and they've gone over and given some guidance on how to do this. But it's important to acknowledge that HUD does not know the specific workings of each and every HMIS software. There are many, many HMIS softwares out there, and so it's important for you as a system administrator to reach out to that vendor, since they understand those nuances in the system, and they'll be able to provide you with guidance and walk you through sort of the process. It's also important as system administrators that now is the time to work with subrecipients that are providing rapid rehousing services, so that you understand and that they understand how intake dates are being collected in rapid rehousing. So the guidance that HUD's provided on this for the purposes of the CAPER is that only those persons who are found eligible for rapid rehousing services should be entered into HMIS under the rapid rehousing component. So what this means is that although a person may be initially entered into HMIS, meaning they may be screened for eligibility, they may go to a project and try to understand if rapid rehousing is something that they can actually reserve services for, they're not going to be considered enrolled under the rapid rehousing project type until they've been determined and confirmed eligible for rapid rehousing services. So that's an important thing to understand, and it's certainly a training issue for an HMIS system administrator to make sure that all of your rapid rehousing projects understand that and that it's being consistently applied across programs. In the future, it's going to be necessary for the HMIS softwares to differentiate between services and rental assistance, since those are two types of activities for both rapid rehousing and for prevention. So it's important now to think through rapid rehousing as you've thought through any stay in a permanent housing project, meaning the old shelter plus care or permanent supportive housing. So rapid rehousing is counted on the housing inventory count now as permanent housing, and as in other permanent housing projects, you don't report on the housing inventory people on waiting lists or in application phases of the housing, only those that are in residence. So that ties into the previous guidance of just counting people as being enrolled in the rapid rehousing project type when they're actually determined eligible and starting to receive services. This may require some extra work. It's a little more nuanced, so you've got some time to now think through and get an understanding of what rapid rehousing projects you have in your community and how to have them set up properly so that you're doing this. And HUD absolutely intends to provide some additional guidance on this. So it's something that if you're not clear about, certainly use the guidance from today, ask a question through the AAQ, and know that HUD will provide some more guidance on this. All right, just a couple more in terms of types, and then we're going to get into actually showing you the screens that are in IDIS. So not a couple more, I'm sorry. This is the last one in terms of project setup for sysadmins to consider, and that's homelessness prevention. So as I just talked about, this is separate from rapid rehousing. So again, it's different than how it was set up for HPRP, and it's important that the project is set up distinctly in this way. The project should not generate CAPER information if it's recorded in the HMIS as an HPRP type. So what that means is that the guidance that vendors have been given on this is to only count in those projects that have either rapid rehousing or prevention separately. So if someone used the sort of old project type of HPRP, that should not be a trigger for the CAPER to be generated. It's really important that folks now take a look at how the projects are set up and make sure that it's correctly attributed to either rapid rehousing or prevention. So as is the case for rapid rehousing, the CAPER is only going to be reporting for prevention on those persons who had an open record in the project at some point during the reporting period, including those who were entered and exited during the period. So only for those persons that are found eligible for prevention should they be entered into HMIS under the prevention code. So although a person may be initially entered into HMIS at the intake process as they're being screened, because that's something that those types of programs need to be able to record, that person's not going to show up on the CAPER and not going to be considered enrolled until they've actually been confirmed and determined to be eligible for the program. So we've gone through, and I apologize rather quickly, at the beginning, the different project types and how this should be set up in your HMIS, not only in terms of project type, but in terms of how to track when someone's entered into the program and what their project stay looks like. So that guidance is something that can also be found in the ESG CAPER instructions. So if by chance you forget a detail that I went through, or I went through something a little too quickly in the beginning, there is some more guidance that is provided in the ESG CAPER instructions that'll really sort of walk you through this as well. You should always be going to, if you're the sysadmin, talk to your vendor as well to make sure that you've got the nuances down correctly in terms of how they set it up. And vendors, of course, have the opportunity through HUD's vendor forum to ask additional questions and get some more information. So don't be worried about if you don't have everything set up perfectly now. Again, there is some time to sort of make sure, and now is that time to really make sure that you've got it set up correctly. Changes can be made, and probably the biggest one for folks to consider is just making sure that prevention and rapid rehousing are being treated separately. So HUD, as we've mentioned before, they understand this is really a sort of a transition period in many ways. So it's critically important to make sure that you are working with your vendor, being proactive, taking the initiative, and sending, of course, any follow-up questions that you may have through the AAQ. All right, so we've gone over now that setup portion. That's really important for HMIS system administrators to understand. And now we're going to dive into the last few slides, that last half an hour or so, to go over screen by screen what folks are going to be seeing when they are in IDIS in the CAPER. So as we talked about before, each ESG recipient is required to complete the ESG CAPER screens. The CAPER is also a report, though, that includes financial information, and there's no expectation that that financial information is going to be generated through HMIS. So HMIS, when we go over these slides, HMIS is not going to produce everything, so don't get angry at your vendor if you see that the financial questions aren't in there. They shouldn't be. Your HMIS generated report is really what's going to provide you as the recipient or as a subrecipient trying to generate the report for the recipient. It's really what's going to provide you with the information on clients served. And anyone, whether they be a recipient or someone working on HMIS, anyone who's familiar with HUD's annual performance report or the APR knows that that's a very lengthy report, and that's a very time-consuming report to enter in. You hopefully will be pleasantly surprised to see that this transition CAPER, by comparison to the APR, is a much more succinct report and one that does not ask nearly as many questions as that report does. Again, that may change over time, so take advantage of the fact that now's this transition period and get things set up properly. So there's one additional phrase that's referenced here on the slide and that you may hear from your ESG projects, and that's the CR65. So the CR65 is the portion of the CAPER in IDIS that is referring to the HMIS data. So that's what folks mean if they're asking you for the CR65 report. They're talking exactly about getting this HMIS portion of your CAPER. All right, so as I talked about, this is a very different report in terms of scope than some other reports that people may be used to. So hopefully that's a positive to take away from this. The setup may be a little tricky. It may take a while to get the project set up correctly, and of course to make sure that everybody's on board and entering data into HMIS. But it is relatively speaking not a very comprehensive amount of information, but very, very important information for people to be reporting to HUD right now. So the 4 questions that are listed up here on the screen are those that are reliant on HMIS data. So one is sort of a general count of persons served, and we're going to show you the screens and go over some of the details about how that data is reported out. The other is just gender, so wanting to know, as the name sort of says, just the gender of those that are served by the project. Age, and then subpopulations data, which is probably the most nuanced, and we'll spend a bit of time, of course, on all these, but that's one that certainly has quite a bit of information to share on. So we'll go through these, and again, these are screenshots from IDIS. So if you don't have access to IDIS, hopefully this is something that will help you understand what your recipients are seeing. And vendors hopefully have been given enough guidance so that the screens that are in HMIS in the generated report should align pretty closely with what's in IDIS, but HUD does understand that there are some differences, so we're going to talk through some of those as well. Okay, so this first one, again, it's a general persons served, and as we talked through when we went over how people are counted in this report, your persons served is really going to be a straight-up count by adults, children, and also by type of project or type of activity that people were served under. So homelessness prevention, rapid rehousing, shelter, and then a total are listed here. So street outreach is missing from this, meaning that there's not a separate or distinct count for street outreach in IDIS. However, you should be including street outreach projects in your overall total, since they absolutely were persons that were served by the project. It's also important to know that, again, we talked again about anyone that's correctly under that project type of homelessness prevention. That's who's going to show up here in the homelessness prevention chart, as well as for rapid rehousing. You're only going to be getting data for prevention and rapid rehousing on those clients that were enrolled in the project once they were determined to be eligible. So in terms of projects, making sure that they've got a great handle on how many people they should be anticipating seeing in this report, always go back to thinking about what we said earlier in terms of someone's not considered served or not going to show up there until they've been determined eligible for prevention and rapid rehousing. Of course, again, that's reliant on it being applied across the board, but that's certainly a training issue to make sure that you've got down pat for folks. Emergency shelter. So for shelter for 4C, that's going to include anyone that was served by emergency shelter, a day shelter, transitional housing, and essential services only. That's everyone that's going to show up in the shelter table right there. We see for all of these tables, don't know, refused, and missing information. And so those are allowable responses for this, and how someone would show up there is simply if their date of birth or their age is missing. So don't know, refused should be any clients, hopefully very few, but any clients who refused or said that they didn't know their date of birth. Obviously, if you don't have the date of birth, your HMIS system can't tell you if it's an adult or a child. So that's where those clients will show up. So they won't be excluded from the report. They'll just show up there in that don't know, refused row. And then missing information is going to be anyone who just nothing was entered for date of birth. So it doesn't, the option of don't know and the option of refused weren't selected. It was instead simply nothing entered into the HMIS for date of birth. Those clients will still be reported out, so the projects will absolutely still get credit for serving those clients. Anticipate in the same way that HUD has wanted folks to be very cognizant of data quality on the APR. It's very important for you to also work with your projects to make sure that you've got good data quality for this this CAPER report as well, especially since it's such a small, relatively speaking, amount of data that's going to be showing up there. All persons served in street outreach are, again, they should be showing up in the totals. It's important to note that in IDIS, the street outreach component, as I talked about, it was erroneously omitted from the screen. So you're still going to be required to report out on this information. So the person served by street outreach, they should absolutely be included in the generated report. So your vendor should have a way of showing you who was served by street outreach. And question 4D, so that total that I mentioned there, total persons served, that's going to include all persons served by anybody in shelter, so 4C, rapid rehousing 4B, prevention 4A, and then street outreach as well. So your 4D is not going to be a perfect sum of 4A, B, and C. It's going to also need to include, again, those clients that were served by street outreach. So maybe a little tricky. That may be something that someone could think that there is something wrong if 4D isn't sum up to 4A through 4C, but it's instead just a reflection of the fact that it was incorrectly left out. Street outreach was incorrectly left out of the IDIS screen, so that's why it's going to look a little different there. Okay, so that is the basic premise of question 4. It's relatively straightforward, and again, it's an overall count by adults, children, and then folks that you don't have date of birth information on of everybody that was served by the project. Okay. It's also important to note that persons can be served in more than one, they can show up in more than one table on 4A through 4C. And so what we mean by this is there, as we talked about a bit before, there can absolutely be multiple project stays, and there can even be multiple project stays by clients in multiple project types. So someone may receive shelter services as well as rapid rehousing. That's one example. Clients, again, they can be reported in more than one table in question 4 if they've been served by more than one project type in the reporting period. So what this doesn't mean is that if I came in and I received prevention services twice, that I would show up here twice. It instead means if I received both shelter and prevention services, I could show up in 4A and 4C. So again, we're talking about multiple project stays and people being able to show up in more than one box here in question 4. That is dependent on them receiving a different type of project. So it's got to be some sort of combination of services for them to show up here more than once. So it may not be something that you run into with a great deal of frequency, but it's important for you to understand in terms of why some of the data may not look quite right, because the totals are, again, going to be unduplicated in 4D. So what I mean by that is if I show up in 4B as being served by rapid rehousing, I would show up there once as an adult. And then let's say that I've also received during the same reporting period shelter services. I would show up as a 1 in 4C. When it comes to 4D, though, I'm going to show up, since I am just one person, as just 1 in 4D. So just to further complicate things in terms of the street outreach table being missing here from the screen in terms of why your total may look a little different, it's also important to understand that the reason why the totals may also be different if people are receiving more than one type of assistance during a reporting period. So it's really important to look at the data with regularity to make sure that your projects understand when to enroll people in a project and that you understand sort of what's being reported out here in the table. Okay, the next 2 questions are very straightforward, so we won't spend too much time on these, but do want to make mention of them. So gender is simply that. It's going to be reporting out on all persons served. It's not breaking it out by project type. So this total should equal the total that was put there in 4D for an unduplicated count of all persons served. Persons who, as it says there on the screen, who entered don't know, refused, and missing, they're going to show up as unknown in the CAPER. So that's how the data is reported out here on the screen. So not separate rows for don't know, refused, not a separate row for missing. It's going to be unknown for this question. Okay. This is something, though, that HUD hopes to fix, so it may be something that you see in future releases of these screens. All right, moving right along, question 6, age. Okay, this again is a total of all persons served. It's an unduplicated count, so just as question 5 should match the total in question 4D, so should question 6. There is another fix because there is a discrepancy between what was in the programming instructions for HMIS vendors and what people are seeing in IDS. Slight discrepancy in that over 24 is not stated in that way in the HMIS instructions. It's instead 25 and over. So it doesn't change the data collection requirements at all. In order to get date of birth, in order to get age, you've got to have date of birth and age information entered into the HMIS, but just a programming thing that HUD is working to fix on the IDIS side of things to make it align with HMIS. Okay, and this last question is the one that I mentioned is a bit more complicated, and I do want to pause here for a second and also acknowledge the fact that HUD has stated, and they are very aware of the fact that many ESG recipients are not yet able to collect the data required here to complete the special populations table. So as many of you know, we're sort of in a different phase of data collection in that there are sort of evolving. The data standards are in the process of being updated. They're not finalized yet, and then when they are updated, of course, there'll be some changes that impact data collection requirements for ESG. So sort of without those data standards final, HUD absolutely understands that there could be some data for this piece in particular for subpopulations, which goes a bit beyond some of the basic demographics and asks about things like veteran status, domestic violence, HIV/AIDS, and disabilities in terms of substance abuse or mental health, but these are sort of above and beyond some of what projects may be collecting right now. We certainly encourage you to work really hard with your projects to, if they can collect the data at this point, to please have them do so. It'll mean a more complete CAPER, which is better for everyone. But the guidance right now is that if the data was not collected in an ESG project on any of these elements, so if it wasn't collected, HIV/AIDS status is one example, then a 0 should be entered here, and that would indicate again that the data wasn't collected. Additionally, the first guidance that was provided to vendors on programming the CAPER indicated, that there was only one total chart, not the several charts that you see here. So some vendors may have only programmed for the total special population served and may not have it broken out by the project type, meaning they may not know just yet how many clients served by prevention also had these disabilities versus rapid rehousing and shelter. They may only have the total number. So if that's the case, if when you log into your HMIS and you try to run your CAPER and you look up there and you're not seeing the same columns that you're seeing in IDIS, that's okay. HUD understands that, and they ask again that you simply put in a 0 into the program type boxes. Okay. So this question very much so reflects the real transition period that we're going through with both data collection and reporting. Please just work very closely with your recipients to get as much data as possible in HMIS. If they don't have it, though, then that's fine. HUD absolutely understands that for this question in particular, and will, again, provide some separate guidance on that. Okay, there are a few other special considerations that we want to go through. We've got just about 10 minutes left to the day, and we are through most of the content, so we'll get through all of this, but just want to go quickly over these last few items. So it's important to understand that there are a lot of struggles that recipients in particular are probably facing as they're trying to complete this CAPER. The few that we thought of in preparing the webinar are listed up here. So one potential obstacle and thing to keep in mind and to work with the recipients on is that subrecipients may receive their funding under multiple project component types, meaning the same organization may receive funding for both prevention and rapid rehousing, or prevention and shelter. So it's important that each organization and each project knows sort of how to handle that and the project setup, and how to make sure that they've got all the component types set up there properly and are able to run the reports as accurately as possible. So that's one consideration to keep in mind. The other consideration is, as we talked about a bit in the beginning, victim service or legal service providers can use comparable databases for data collection, which was the case as well for ESG. So this is not necessarily new that they're using these comparable databases, but it's important to keep that in mind, in that the requirement is still to do one recipient report, meaning the recipient's got to be able to generate one CAPER across databases, across subrecipients, and that's where tools like the aggregation tool may be very helpful. So those tools, the generation tool, which can help people generate the HMIS, or generate the CAPER, using HMIS data, or that aggregation tool, which can help with comparable databases and HMISs, meaning trying to get that data all compiled into one report. Those are important tools for you as a system administrator to be aware of, and to make sure that your recipients and subrecipients are aware of as well, since they've got to really be on the hook, recipients in particular, for generating this one report. So keep that in mind, and to the degree possible, try to stay on top of those resources as well. Okay, the last one, which I've talked a bit about already, but it's important to understand and to have patience with everyone as they're working to get all this done, because they're very much, very, very possible that there are going to be multiple subrecipients with the same project types within one community. So it's going to be very hard potentially to aggregate all of this data and to make sure that it's done as much as possible. So whenever possible, an HMIS should have the functionality to do just one ESG CAPER subrecipient report that shows who was served under which component type. If that's not possible, HUD understands that, and it's of course something that that can be handled separately. But again, we've talked about the real onus is on the recipient to do that one report, and it's important that they are aware of the tools and that you sort of help them as much as possible use those tools to ensure that there's unduplicated counts where needed and that there is an aggregated count for that one grant. Okay, there are a few next steps that we just want to take a couple minutes to go over. So if you have not already, it's important to take a look at the HMIS programming instructions for the ESG CAPER. These instructions are not nearly as long as the APR instructions. I believe that they're just under about 20 pages. They go through what the questions are, and the same way that we've talked about them today, they go over some of the project setup guidance that was discussed as well. It's very important that you understand these as a sysadmin and are not reliant on just your vendor understanding that. Vendors have put in a lot of time and effort to make sure that the CAPER is done correctly, and I'm sure that they'll continue to do that as people start using the report. But it's also important that you're very well informed as the lead or as the recipient of ESG funding, that you're aware of what HUD's expectations are. That programming instructions document is the piece of official HUD guidance on the ESG CAPER, so it's very important that you're familiar with that as well. It's also really important as a next step that you take the time to look and make sure that the HMIS that you've got is capable of generating data across multiple project types for the CAPER. So can your HMIS, can you do the project setup in the way that we described for all the component types, and can you generate that CAPER that can look at data by prevention versus rapid rehousing versus street outreach and shelter? So take a look at that now and make sure that everything's functioning properly. It's also important that ESG recipients ensure that that they've got a solid understanding and that you've got a solid understanding of all the different reports that could be generated, meaning for your area, for your continuum of care, or if you're a multi-COC or statewide HMIS implementation, how many ESG recipients are out there? How many reports? How often are you going to necessarily be getting this request to generate the report? So familiarize yourself with that. Understand sort of how these projects have set themselves up, meaning how many subrecipients they have. Then understand all the project types that are funded through each subrecipient. So your community may have opted to only invest in prevention and rapid rehousing, and so there may not be a shelter component. So you may not necessarily have to worry about that quite as much. So get an understanding of the lay of the land, what the expectations are in terms of setup, and then what that'll mean for the reports that you've got to generate. And then last, but I would argue most important, make sure that you've gone in as your HMIS lead and as the person perhaps even on the hook for doing the report as the ESG recipient. Make sure that you've looked in your system to make sure that everything's set up correctly for each ESG subrecipient. Make sure that you've got the project type correctly identified and that you are clear across the recipients and subrecipients about how the data is being entered. So make sure that people aren't being enrolled for prevention or rapid rehousing until they're determined eligible. Make sure that everything sort of is in place so that the data can be collected as best possible. This slide, and again, the slides will be available on OneCPD, so no need to have a mad dash and write down all these URLs, but there are several resources that are out there now that could be helpful. One is a webinar from some time ago that goes over the ESG program in general. So if you're curious about the different program components we talked about today and want to understand what the Emergency Solutions Grant program is all about, there's a webinar that goes over that. There's another one from way back in 2011 that goes over the different requirements for ESG projects to participate in HMIS. There's a reporting update, which is a listserv message that goes over from HUD what the expectations are in terms of data collection and reporting. And then there are, of course, the reporting instructions, which we've mentioned as something that we really encourage everyone to take a look at and make sure they understand. They do a really great job of going through everything we've talked about today and really presenting to HMIS vendors and to HMIS leads a solid understanding of how to get your project set up correctly in the system. And then the last, if you're very curious, there are a couple pages in a very long con plan manual which goes over the CAPER in general, but those 2 pages go over the ESG portion of it, the HMIS data. So you can take a look at those to get confirmation of the screens that we've showed you today. Okay, the last bit, I think I hear Jeff. Are you going to
Thank you very much for the presentation there. And thank you, Marlisa and Natalie, and also thank you to Tom, Michelle, and Karen for answering questions. And thank you to all of you for joining us for this webinar. You should now be able to understand the data collection and reporting requirements for the revised ESG CAPER. You should be able to understand and accurately interpret the revised ESG CAPER, and to be able to identify the resources and assistance available to help you with your ESG CAPER. As a reminder, if you have additional questions, please submit them through the OneCPD Ask a Question page. The webinar recording and PowerPoint presentation will be posted shortly to the OneCPD Resource Exchange and Training Events page. Also, as a reminder, an email will be sent out to all attendees following the training with instructions for how to get credit for this training and how to complete the feedback survey. You can obtain information or assistance from the OneCPD Resource Exchange by searching the resource library, checking out the OneCPD news, or using the Ask a Question function, or finally by requesting technical assistance. Thank you again, and enjoy the rest of your day.